Hello everybody, and how are you? Okay, so today what we're gonna discuss is the adult cardiac arrest algorithm and a BLS. Okay, so someday you were walking on the street, okay, and suddenly you see a victim lying on the ground. Oh my god, what you will do right now? Oh my god, you will cry beside him, or you will run away, or what you will do? Okay, so the first step is verify the scene safety. Okay, here the first step is checking the safety of the place. It's very important to check the safety of the place because we already have one victim and we do not want them to be two victims, you and the victim. So it's very important to check the safety of the place. Okay, then if the place is safe and everything is okay, so what is the next step? The next step is the checking the responsiveness of the patient or of the victim, checking the consciousness of the victim. Okay, so victim is unresponsive. Shout for help. Activate emergency response system via mobile device or get AD. Okay, so after I check the safety of the place, I check for responsiveness or the consciousness. How can I check? By tapping the shoulder of the victim and tell him, are you okay? Are you okay? Are you okay? The victim is not responding. The victim is not conscious. Start to shout for help. Any help please? Any help please? And activate the emergency response system. So what is the first step? Is checking the safety of the place, and then a check for consciousness and responsiveness of the patient. Okay, and he is not conscious, he's not responding, shout for help and activate emergency response system. Okay, and what is the third step? The third step is checking for breathing and pulse. Look for no breathing or only gasping and check pulse. Okay, check pulse and breathing at the same time. So the first step is checking the safety of the place, then check the consciousness of the patient, and the third step is checking for breathing and pulse at the same time. Look at the chest wall tangentially to see if the chest wall is rising or not, and if it's rising, so this patient has breathing, and if it's not rising or a silent chest, so this patient has no breathing. That's really nice. And at the same time, you palpate the carotid artery to feel the pulse. Okay, and while you are checking for breathing and pulse, you do not have to exceed 10 seconds. Okay, that's really very nice. So you have three probabilities right now. The first is you have a normal breathing and has pulse. This patient or this victim has a normal breathing and has pulse. This is one probability. And another, no normal breathing but has pulse. And the other, which is the worst, no breathing, has no breathing, or only gasping and has no pulse. Okay, let's see what we have to do in every step. This patient has normal breathing and has pulse. He is okay, but you must monitor him until the emergency response system arrives. Wait and observe. Monitor and observe. He is okay, he has normal breathing, he has pulse. Just wait and observe until the emergency responders arrive. Okay, very nice. But if this victim has no normal breathing but he has pulse, so he has problem with his respiratory system, but he has no problem with the cardiovascular system. Okay, so what you will do? you will provide him rescue breathing. Okay, so what is rescue breathing? Is one breath every 5 to 6 minutes, one breath every 5 to 6 seconds, sorry, one breath every 5 to 6 seconds. So you will do one breath, 1, 2, 3, 4, 5. Again, one breath, 1, 2, 3, 4, 5. Okay, one breath every 5 to 6 seconds, or about 10 to 12 breaths per minute. Okay, and also activate the emergency response system after 2 minutes. Continue rescue breathing. And what is very important, to check the pulse about every 2 minutes, because this patient may have cardiac arrest. These patients may have cardiac arrest, so it's very important to give rescue breaths and check the pulse about every 2 minutes. And if no pulse, begin CPR. Okay, if no pulse, begin CPR. And if of possible opioid overdose, administer naloxone, because if this patient has a problem with his respiratory system due to opioid overdose, he will not regain his respiration until you give him the antidote. Okay, that's really very nice. So what is the first step? Is checking the safety of the place. And what else? Then check for responsiveness of the patient. Are you okay? Are you okay? He's not okay. Okay, look for breathing and pulse at the same time. You don't have to exceed 10 seconds while you are checking breathing and pulse. And then you have three choices. You have normal breathing, and this patient has pulse, so just monitor and observe. Okay, here. Or no normal breathing but has pulse, give him rescue breathing. So what is rescue breathing? Is one breath every 5 to 6 seconds. And do not forget to continue rescue breathing for 2 minutes. Check pulse about every 2 minutes, because this patient may develop cardiac arrest, because the cardiovascular system and the respiratory system are one unit, and when you have affection in one of them, so it will affect the other, of course. Okay, it is called cardiopulmonary resuscitation. Okay, they are one unit. Okay, that's really very nice. Okay, let's see here. This victim has no breathing, or only gasping, and has no pulse. So he has no breathing, he only gasps, and he has no pulse. So start compressions immediately. Yes, start compressions immediately. When I have to start compressions? If this patient has no breathing, he is not breathing, and he has no pulse. Even if he is gasping, start compressions, because gasping is not a normal breathing. Gasping may be in the first minutes of after sudden cardiac arrest. So the patient is not breathing, the patient has no pulse, or even he is gasping. Okay, start compressions immediately. And this is a question on the BLS exam. Okay, then, so what is the first step? Check the safety of the blaze, then check responsiveness. Are you okay? Are you okay? He's not okay, he's not responding to you. So shout for help. Okay, then check for breathing and pulse. He has no pulse, he has no breathing, start compressions immediately. Okay, CPR. We have to do effective CPR. So what is effective CPR? We will know in details after that. CPR begins cycles of 30 compressions and 2 breaths. Cycles, every cycle is equal 30 compressions and 2 breaths. Okay, I will do 5 cycles in 2 minutes. Okay, begin cycles of 30 compressions and 2 breaths, and use the AED as soon as it's available. You do CPR. Okay, 5 cycles for 2 minutes. Then if the EED arrives, you have to check the res. Nice. Check this res if it's shockable or non-shockable. Once you attach the AED external automated external defibrillator to the victim, it will tell you that the res is shockable or not because it is automated. Okay, so if it is shockable res, by tapping on the button, the device will deliver a shock. Okay, the device will deliver one shock. Then it's very important, resume CPR immediately for about 2 minutes 5 cycles. Okay, so you checked rhythm by the EED after it arrived. Okay, and rhythm is shockable. If it's shockable, deliver one shock and resume CPR immediately for about 2 minutes until promoted by AED to allow rhythm check. Okay, but if it's non-shockable rhythm, if it's not shockable, the AED will not deliver a shock. Okay, but you must resume CPR immediately for about 2 minutes. Okay, until you check the rhythm again after 2 minutes and after 5 cycles, and you will see if it's shockable or non-shockable. And if it's shockable, you will give a shock. If it's non-shockable, resume CPR. Okay, tell the emergency responders arrives and call for the ambulance. Okay, again. Okay, you will do CPR. In every cycle you will have 30 compressions and 2 breaths. Okay, and you will do 5 cycles in 2 minutes. Once the EED arrives, you will start to check the rhythm. If this rhythm is shockable or non-shockable, and it will tell you because it is automated. Okay, and if it's shockable, you will give one shock and resume CPR. And if it's not shockable, you will resume CPR immediately. We do not need the shocks in the non-shockable rhythm. We do not need shocks in the non-shockable rhythm, so just you resume the CPR. Okay, until the ALS providers take over or the victim starts to move. Okay. So let's discuss every step in details again. Okay. Verify scene safety, check for responsiveness, and get help. Okay, the first step is verify that the scene is safe for you and the victim. You do not want to become a victim of yourself. Okay, take care, it's very important. And then you check for responsiveness by tapping the victim's shoulder in the shout, "Are you okay? Are you okay?" If the victim is not responsive, shout for help. And activate the emergency response system. Okay, nice. And get the EED defibrillator. Okay, if you do not have EED defibrillator, okay, and you want to assess the patient, you will assess the victim after 5 cycles and after 2 minutes. You will assess the pulse and the breathing. Okay, if you do not have EED, you will assess the pulse and the breathing, and if he has pulse and breathing or regain his pulse and breathing, monitor and observe. And if he still has no pulse and no breathing, you will continue with CPR. Okay, nice. Okay, then assessing for breathing and the pulse. You assess them at the same time. Breathing. How can I assess breathing? To check breathing, scan the victim's chest for rise and fall for one more than 10 seconds. You don't have to exceed 10 seconds. 10 seconds is maximum because every second in this victim's life is very important. We are saving lives. Okay, if the victim is breathing, he is breathing. Monitor the victim until additional help arrives. If the victim is not breathing or only gasping, he is gasping. It's very important. This is a question in the BLS exam. This is not considered a normal breathing. Gasping is not considered a normal breathing, okay? And it is a sign of cardiac arrest. Gasping is considered the sign of cardiac arrest. Okay, this is for breathing. If the victim is breathing, monitor the victim until additional help arrives, and is not breathing or only gasps. This is not considered normal breathing and is a sign of cardiac arrest. Check for pulse. Okay. To perform a pulse check in adult, palpate the carotid pulse. Yes, palpate the carotid pulse. If you do not definitely feel a pulse within 10 seconds, begin high quality CPR. If you do not definitely feel a pulse within 10 seconds, begin high quality CPR, starting with chest compressions. Okay, nice. Let's see the agonal gasps. Agonal gasps are not normal breathing. Yeah, we know. Agonal gasps may be present in the first minutes after sudden cardiac arrest. This is a question, okay? Okay. A person who gasps usually looks like he's drawing air in very quickly. The mouth may be open and the jaw, head, or neck may move with gasps. Gasps may appear forceful or weak. Sometimes may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snore or groan. Gasping is not normal breathing. It is a sign of cardiac arrest. Okay. Then locating the carotid pulse. Locate the trachea using 2 or 3 fingers. Slide these 2-3 fingers into the groove between the trachea and the muscles at the side of the neck where you can feel the carotid pulse. Feel the pulse for at least 5 but not more than 10 seconds. If you do not feel definitely the pulse, begin CPR, starting with the chest compressions. Okay. And after you check the pulse and breathing, you determine next actions. What you will do. What is your decision right now? Okay. You will go with which pathway? It depends. It depends on the victim's state. Okay? His pulse and the breathing. Nice. So, if the victim is breathing normally and a pulse is present, monitor the victim. If the victim is not breathing normally but the pulse is present, provide rescue breathing. Okay. Confirm that the emergency response system may be activated because this patient may develop cardiac arrest at any time. You have affection in the respiratory system, and the respiratory system and cardiovascular system is one unit, and so may develop cardiac arrest at any time. Okay, continue rescue breathing and check pulse. Very important. Continue rescue breathing and check pulse about every 2 minutes. Be ready to perform high quality CPR if you do not feel a pulse. Okay, if opioid use is suspected, consider naloxone as the antidote. Nice. If the victim is not breathing normally or is only gasps and has no pulse, oh my god, what you will do right now? You will cry beside him, or what you will do? He has no pulse, he has no breathing, or he's only gasping. So what you will do right now? Prepare yourself to do high quality CPR. Begin in a high quality CPR. That's really very nice. Okay. Okay, begin high quality CPR starting with the chest compressions. If the victim is not breathing normally or is only gasping and has no pulse, immediately begin high quality CPR starting with chest compressions. Also, it's important to remove or move the clothing covering the victim's chest so that you can locate the appropriate hand placement for compression. Okay. Also, this will allow placement of the AED pads when the AED arrives. Okay. Attempt defibrillator with the AED. use the AED as soon as it's available. Okay, to check the rest after 2 minutes and 5 cycles. And if you do not have AED, check the pulse and breathing to assess the patient. Okay, and do not forget to resume the high quality CPR. Immediately resume high quality CPR, starting with chest compressions when advised by the AED. Continue to provide CPR and allow for AED promos until advanced life support is available. Okay, auto chest compressions. What is the importance of chest compressions? Why am doing chest compressions? Why? Each time you stop chest compression, the blood flow to the heart and the brain decreases significantly. Once you resume compressions, it takes several compressions to increase blood flow to the heart and the brain back to the levels present before the interruption. Thus, the more often chest compressions are interrupted and the longer the interruptions are, the lower the blood supply to the heart and the brain is. So, you have to do compressions effectively and minimize interruptions as much as you can. Minimize interruptions as much as you can. Okay. What is high quality chest compressions? What is high quality CPR? You all the time say that we have to do high quality CPR, we have to do effective CPR. So what is high quality CPR? High quality CPR means you compress hard and fast. So what is hard and what is fast? You mean by fast is quickly? No, I do not mean that. I mean to compress at a rate of 100 to 120. Okay, it's like the rate of the heart. Okay, compress at a rate of 100 to 120, not slow. Okay, compress the chest at least 5 centimeter. That's what I mean by deep. Yes, deep is to decrease the chest diameter to its anterior 1/3. Okay, nearly about 5 centimeter. So what I mean of compress hard and fast? Hard to decrease the chest wall diameter to its anterior 1/3 or decrease at least 5 centimeter. Okay, and fast mean with a rate of 100 to 120. Okay, then allow complete chest recoil so that the heart can fill. Okay, so allow the chest to recoil. Minimize interruptions in the compressions. You do not have to exceed 10 seconds. It's very important. High quality CPR. How quality chest compressions? It's a question but also on the BLS exam. Okay. If the victim is not breathing normally, is only gasping and has no pulse, begin CPR starting with chest compressions. Single rescuers should use the compression to ventilation ratio of 30 compressions to 2 breathing when giving CPR to the victims of any age. Single rescuers. Okay, we are talking about single rescuers. Single rescuers. In single rescuers, you will do compression ventilation ratio 30 compressions to 2 breaths. Okay, that's really very nice. Thank you very much to you all.